Hello, I am Dr. Carla Manchini, a urologist, and in this video, I will share with you 5 compelling reasons to start practicing penile muscle training. Sexual health is a cornerstone of overall well-being, yet it's a topic many men hesitate to discuss openly. Challenges like maintaining firm erections, controlling ejaculation, or grappling with insecurities about performance are far more common than you might think. In fact, studies suggest that over 50% of men experience some form of erectile difficulty by the age of 50, and issues like premature ejaculation affect up to 30% of men globally. These struggles often lead to emotional distress, strained relationships, and a diminished sense of self-worth. The good news is that there's a simple, natural, and scientifically backed solution that doesn't involve medications, invasive procedures, or costly therapies. Penile muscle training. By focusing on strengthening the pelvic floor muscles, you can unlock a host of benefits, from enhanced erection quality to greater control over ejaculation, all while boosting your confidence and alleviating the anxiety that often accompanies sexual performance concerns. Let's delve into how these exercises can revolutionize your intimate life, offering a pathway to not just improved physical function, but also emotional resilience and relational harmony. Penile muscle training, often referred to as pompoirism, is rooted in the principles of pelvic floor rehabilitation, a practice long utilized in both men's and women's health. The pelvic floor muscles, a network of tissues stretching like a hammock from the pubic bone to the tailbone, play a pivotal role in urinary, bowel, and sexual functions. For men, the puboxygeus (PC) muscle is particularly crucial, as it supports erectile tissue, aids in ejaculatory control, and stabilizes bladder function. When these muscles are weak or underactive, a common consequence of sedentary lifestyles, aging, or prolonged stress, the result can be erectile dysfunction, premature ejaculation, or even urinary leakage. Pompoirism targets these muscles through deliberate contraction and relaxation exercises, akin to strength training for your biceps or core. The process is straightforward. By repeatedly engaging and releasing the PC muscle, you enhance its tone, endurance, and responsiveness. Over time, this leads to improved blood flow to the genital region, greater neuromuscular coordination, and a heightened awareness of bodily sensations. The beauty of this method lies in its simplicity. No equipment is needed, and exercises can be performed discreetly anywhere, whether you're sitting at your desk, driving, or relaxing at home. Unlike pharmaceutical interventions, which often address symptoms rather than root causes, pompoirism fosters long-term physiological adaptations, empowering you to take control of your sexual health proactively. Let's explore the first transformative benefit, erection quality. A firm, reliable erection is the foundation of satisfying sexual activity. Yet many men encounter moments of frustration when their erection lacks the necessary rigidity or dissipates prematurely. This issue often stems from insufficient blood flow to the penile chambers, known as the corpora cavernosa. During arousal, the brain signals blood vessels to dilate, allowing oxygen-rich blood to flood these chambers and create an erection. However, if the pelvic muscles are weak, they fail to adequately compress the veins that drain blood from the penis, leading to suboptimal engorgement. Pompoirism addresses this by strengthening the muscles responsible for maintaining vascular pressure. Imagine your pelvic floor as a pump. With each contraction, you enhance the efficiency of blood retention, resulting in firmer, longer-lasting erections. Clinical studies have shown that men who engage in regular pelvic floor exercises experience a 40 to 50% improvement in erectile function within 3 to 6 months. Moreover, these exercises stimulate nitric oxide production, a molecule critical for vasodilation, and improve endothelial health, further optimizing circulation. Patients often report noticing changes within weeks. Erections become more spontaneous, resilient to positional shifts, and less dependent on external stimuli. This isn't just about physical enhancement, it's about reclaiming confidence. The anxiety of "will it work this time?" fades, replaced by a sense of mastery over your body. And because pompoirism is a natural practice, it sidesteps the side effects associated with medications, such as headaches or dependency, making it a sustainable choice for men of all ages. The second benefit, control over premature ejaculation, is a game changer for men who've struggled with timing and endurance. Premature ejaculation, PE, is often rooted in hypersensitivity, psychological stress, or poor coordination between the pelvic muscles and the nervous system. The PC muscle, when underdeveloped, can't effectively modulate the rhythmic contractions that trigger ejaculation. Pompoirism trains this muscle to act as a brake, allowing you to delay ejaculation by recognizing and managing the buildup of arousal. The exercises involve a technique called graduated tension. By practicing sustained contractions followed by gradual releases, you learn to identify the point of no return and develop the muscular control to pause just before it. This mirrors principles found in behavioral therapies like the stop-start method, but adds a physiological dimension by strengthening the muscle itself. Research indicates that combining pelvic floor training with mindfulness techniques can extend intravaginal ejaculatory latency time, IELT, by up to 300%. Beyond the mechanics, there's a profound psychological shift. Men report feeling more attuned to their bodies, less governed by performance anxiety, and more capable of prolonging intimacy. Partners, too, notice the difference. A study published in the Journal of Sexual Medicine found that couples with a male partner practiced pelvic exercises reported higher relationship satisfaction, citing improved synchronization and mutual enjoyment. It's important to note that progress is gradual. Consistency is key. Starting with short sessions of 5 to 10 minutes daily and progressively increasing intensity yields the best results. Over time, the PC muscle becomes more responsive, turning what once felt like an involuntary reflex into a skill you can deftly manage. The third benefit, increased sexual desire, may surprise those who view libido as purely hormonal or psychological. While testosterone levels and emotional well-being certainly play roles, desire is deeply intertwined with confidence and bodily awareness. Imagine two scenarios. In the first, a man feels uncertain about his erection quality and anxious about disappointing his partner. In the second, he's secure in his physical capabilities and excited to connect intimately. Which scenario fuels greater desire? Pompoirism creates a positive feedback loop. As erection quality and ejaculatory control improve, anxiety diminishes, and anticipation of pleasure replaces fear of failure. This shift is neurological as much as it is emotional. The brain's reward centers, activated by successful sexual experiences, reinforce desire, creating a cycle of motivation and satisfaction. Additionally, the physical act of exercising the pelvic floor increases blood flow not just to the genitals but throughout the pelvic region, enhancing sensitivity and tactile awareness. Men often describe a renewed sense of vitality, as if their entire lower body feels more alive and connected. This isn't merely anecdotal. A 2022 study in urology research found that participants who engaged in pelvic floor training reported a 35% increase in self-reported libido over 6 months, independent of hormonal changes. Furthermore, the mindfulness cultivated during pompoirism, focusing on subtle muscle movements and breath control, translates to greater presence during intimacy, deepening emotional bonds with partners. Desire, then, becomes less about chasing a fleeting urge and more about embracing a holistic state of readiness and connection. Beyond these three pillars, pompoirism offers improved urinary and prostate health, a benefit often overlooked but equally vital. The pelvic floor muscles play a crucial role in bladder control, and weakness here can lead to stress incontinence, leakage during coughing, sneezing, or exertion. By strengthening these muscles, men can reduce or even eliminate such issues, which become more prevalent with age or after prostate surgery. Enhanced muscular support also promotes lymphatic drainage in the pelvic region, potentially lowering the risk of prostatitis and benign prostatic hyperplasia, BPH. A 2020 meta-analysis in The Lancet highlighted that men practicing pelvic exercises experienced a 25% reduction in urinary symptoms compared to control groups. Lastly, enhanced overall physical resilience emerges as a fifth benefit. The pelvic floor is integral to core stability, posture, and balance. Strengthening it can alleviate lower back pain, improve athletic performance, and even enhance breathing mechanics by optimizing diaphragmatic coordination. This systemic impact underscores that pompoirism isn't just a sexual health tool, it's a cornerstone of holistic wellness. To integrate pompoirism into your routine, begin with foundational exercises. Identify your PC muscle by attempting to halt urination midstream. This should only be done once for identification. Once located, practice contracting and holding the muscle for 3 to 5 seconds, followed by a 5-second rest. Aim for 10 to 15 repetitions, 3 times daily. Gradually increase hold times and incorporate rapid pulses to build endurance. Pairing these exercises with deep breathing enhances oxygenation and reduces tension. Many men find it helpful to set reminders or link practice to daily habits, like brushing teeth or commuting. For those seeking structured guidance, my digital book, Rediscovering Sexuality, Healthy Intimacy After 60, offers step-by-step routines, dietary tips, and strategies to navigate emotional barriers. Available in the first pinned comment, it's a comprehensive resource to reignite passion and vitality at any age. In closing, the journey to transformative sexual health begins with a single contraction. By dedicating a few minutes daily to pompoirism, you invest in not just your physical capabilities but your confidence, relationships, and overall quality of life. The men I've worked with, ranging from their 20s to their 80s, share stories of renewed intimacy, deeper connections, and a profound sense of empowerment. Sexual health is not a luxury. It's a vital component of living fully. If you're ready to take the first step, subscribe to this channel for more insights. Leave a comment with your experiences. And remember, every effort you make today plants the seed for a more vibrant tomorrow. Your journey to rediscovering confidence and joy in intimacy starts now.